great pleasure this morning to introduce to you all Mr. David Crawford with Partnership Health. Some of you have been involved on the peripheral there. Commissioner Evans has served on the board for many, many years. I am a super fan whenever you look at barriers to care and the folks who are not insured in our community that really need health care and the cost to community when those folks aren't served. Partnership Health is filling a tremendous gap in our community, so I'm grateful for Commissioner Evans' leadership. David is doing a very good job of following Mr. John Sparks. You all remember who stepped off as the initial director there, and David has very quickly taken things to the next level. So David, welcome. We're glad to see you this morning. Thank you for being here.
Thank you all very much for having me today and giving me the opportunity to speak. But yes, I do want to start off by thanking Commissioner Joyce Evans for her loyal support and commitment as a Partnership Health Center Board of Directors member, as well as Paige and Bill Slaughter for the communication and collaboration that we've had thus far. Partnership Health Center exists to make sure that being uninsured does not mean being without health care. We serve residents who are working, raising families, caring for loved ones, and contributing to Lowndes County, but who may not have access to employer-sponsored insurance or financial resources to pay for care elsewhere. The most important message I want to leave you with today is this. The uninsured residents we serve are not concentrated in one neighborhood or one part of the county. They are your constituents, they live in every commission district, and they are part of the workforce that helps keep Lowndes County moving. I'm here today to not simply ask the board to acknowledge our work. We're asking each commissioner to become an advocate for Partnership Health Center within your district. You have relationships that we may not be able to access. You speak regularly with business owners, civic organizations, churches, neighborhood leaders, and other community stakeholders. Your voice can open doors and help bring critical resources to fund the care we provide. We would respectfully ask each commissioner to take 3 specific actions. First, identify at least 3 businesses or community leaders in your district who should learn more about Partnership Health Center. Second, make a personal introduction or invite those leaders to join you in attending our next clinic tour on August 18th at 8:30 a.m. Third, publicly recognize Partnership Health Center as an important part of Lowndes County's healthcare and workforce support system to bring additional awareness to our work. As you review the handout provided, I want to remind you that more than 1,900 patients represented in this analysis are not just points on a chart. These are your residents, our neighbors, someone's employees, and loved ones. We help uninsured residents remain healthier, remain employed, to care for their families, and continue participating in the economic life of Lowndes County. This is not only a health care issue, it's a workforce issue, an economic development issue, and a community stability issue. Partnership Health Center works 7 days a week to care for this community, but we cannot fill that health care gap alone. Our request is simple. Help us turn countywide impact into countywide support for Partnership Health Center. Thank you for your leadership, and thank you for helping us give uninsured residents throughout Lowndes County a summer return to care. Any questions I'd be happy to answer. The chart that I did provide, the more than 1,900 are unique patient visits to date from January. So that's
And then you all have provide some assistance where Medicare individuals and that reentry into the hospital.
No, they have to be uninsured, so
Okay.
that, yeah, we do not take any kind of Medicaid or Medicare, unfortunately. So if they come to us and we find that they are insured, we obviously inform